Jim Hoffman here for the EMS Professional. This is your Monday Minutes. Today, as it says right here, we're going to talk about syncope and just point out some key things when you get those syncopal patients about how it's not really just a patient that fainted, right? This is a sort of a common call in EMS, one that a lot of people sort of blow off as being a non-emergent or just somebody that might have gotten up too fast or maybe stressed a little bit in the bathroom when they were trying to move their bowels or, something along those lines. And while that can be the cause, there are other things that we need to be thinking about when it comes to this, call type. So you want to think ahead, right? Think about your assessment. Think about what you're looking for when you are assessing your patient. Don't just make it that they just fainted. Look at all of the signs and symptoms and their history and what might be going on leading up to the syncopal episode. They can all be clues as to why the patient did have a syncopal episode and what they might need to prevent it from happening again or to address the sort of mini alarm that went off by having a syncopal episode that something else is going on with them, right? So you want to check the patient's history. Do they have a history of some sort of cardiac issue, maybe a past stroke or seizure history? Maybe they've had some recent bleeding, ectopic pregnancy, due to ectopic pregnancy, especially you get those females that are of childbearing years. Maybe it's ectopic. Maybe, they're having an issue with that. Find out when their last menstrual period was. Find out if they have any vaginal bleeding. Or maybe the bleeding is from sort of gastrointestinal issue going on, okay? And that's why they had the syncopal episode. Maybe they've had a lot of fluid loss, and that can be from nausea or vomiting or diarrhea. Check their past medical history for previous syncopal episodes and check their medications. Sometimes changes in medications can also cause them to have a syncopal episode as well. Now, signs and symptoms, pretty much, this is the patient again. You're going to get there. They're going to be pretty normal when you get there most of the time, right? They've had the loss of consciousness or maybe even near the loss of consciousness, and they've fully recovered. You might get there. They might have a little bit of a low or decreased blood pressure going on, but for the most part, they've recovered, right? Maybe they're going to complain of some lightheadedness or some dizziness. They might have palpitations. Check their heart rate. Is it irregular? Is it slow? Or is it rapid pulse? Right? These are the types of things you have to look for because it can guide you in your assessment that something else bigger is going on with the patient. Maybe that irregular pulse they have is a new onset of AFib. Maybe the rapid pulse is SVT, right? You don't know, so you can't just use it as just simple fainting. Look for all of the other signs and symptoms that might be going on with the patient. So what are some of the things you can consider when you look at a patient that had a syncopal episode as to why it happened? Most common, of course, what we see a lot of times is that orthostatic changes from getting up too soon, okay? Or getting up too fast after being sitting or laying down too long. Maybe some sort of vasovagal type of an issue. Maybe it's, again, when they try to move their bowels, they have that defecation syncope or the cardiac syncope, right? It could be psychiatric in nature. Maybe even it's a sign of a stroke. Okay, a lot of times patients might have a few syncopal episodes leading up to a stroke. Check their blood sugar. Even if they're not diabetic, you can check and see maybe they're hypoglycemic, and that's why. All right, check to see if they have maybe they've had a seizure. Find out what happened leading up to the loss of consciousness. Look for signs of shock, of course, or maybe even some sort of alcohol issue going on. And again, the medication. Okay, check their medications. And of course, they could be having a PE, or they might be having a AAA as well. All these types of things that you can consider, because if you think about it, pretty much everything we've listed here, we can address in the field, okay, or it needs to be addressed at a hospital. These are not the types of things that you want to just go ahead and leave the patient at home, right? All of these things here, we can pretty much say, okay, we have to address these things in the field. They're pretty much covered under various protocols that we have, or it needs to be addressed at a hospital. You don't want to try to leave these patients home. You want to go ahead and convince them to go to the hospital, even though they might have already had that full recovery going on, right? So when you're thinking about this stuff, guys, just think of one more thing, okay? Make sure you do everything we talked about. Do your full assessment and keep an eye out for signs and symptoms of trauma as well, especially in elderly patients. The syncopized, especially if they're home alone, right? They can fall, hit their head, okay, and have some sort of sign. They can have a head trauma from it. They could even break a hip if they fall someplace that's hard enough, right? So check them for signs and symptoms of trauma if the syncopal episode resulted in a fall after they had it. Okay, again, check out the cardiac stuff, guys, like we mentioned. New onset of dysrhythmia, the recurrent dysrhythmias, the GI bleed, the ectopic pregnancies, all these types of causes that can be of syncope. And remember, like I mentioned, the old person that passes out didn't pass out just because they're old. Okay, 25% of these geriatric types of syncope patients is some sort of cardiac dysrhythmia base. Now, it might have resolved itself by the time you get there, but this is why we do things like 12 lead and cardiac EKGs, and we do our full assessments, because we don't want to overlook a dysrhythmia that might be going on just because it seems like it's a simple fainting spell. So check everything out, guys. Don't blow it off, because you don't want to be the paramedic or EMT that leaves a syncopal patient at a scene because they recovered, and then half an hour later they have a big MI or they have a stroke or something like that, and you could have prevented it by convincing them to go to the hospital. Okay, these patients really need to be transported to the hospital. Guys, as always, you want to follow your local guidelines. Try to go ahead and do your full assessments, and whatever the considering signs and symptoms of what might be going on with the patient that we talked about, go ahead and treat them under those specific guidelines, okay, as needed, okay, for that particular patient. Okay, I'm not saying you got to fit patients into a protocol or fit them into a guidelines, but consider these causes of syncope and then treat them according to your local guidelines appropriately. And maybe it's just a transport to get some blood work done or get some further evaluation done by a doctor, but that might be what the patient needs to uncover why they had that syncopal episode. Guys, I hope you can use these Monday Minutes, but real quick, I just want to remind you that you can go and get a free report here. It's the EMS Quick Study Bullets. It's really a quick exam sort of knowledge report that I put together as part of a TurboMedic resource. It's sort of a study reference that you can use to see a lot of questions and question types you might see on an EMS exam. It's a free report. Just click here on this graphic here. It'll take you to the home page where you can go ahead and sign up and register and get your hands on this free report. It's a download report, so you get it the same day. You just got to go ahead and pop in your email and you'll get this free report. So go ahead and do that. And of course, if you can use these Monday Minutes, I hope you really can. Tell a friend, bring them to the website, let them know about it at emsofficehours.com. Okay. Check out the other Monday Minutes that are going on. And of course, always come check out the podcast, guys. Every Sunday, 7 p.m. I want to hear what you have to say about the podcast and get your feedback on what's going on in EMS as well. So come visit us at emsofficehours.com and listen to the past podcasts. And, of course, visit us every Sunday at 7 p.m. Eastern Time for the live podcast where you can chat with us live or even call in via the toll-free number. All right, guys, that's it for me. As always, Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.